Good afternoon. I am Dr. Vikas Gupta. I am a neurosurgeon. At present, I am consultant and head of neurosurgery at Manipal Hospital, Dwarka, New Delhi. Good to be with you in these difficult times. Yes, COVID is a pandemic, but at the same time, we cannot or we should not overlook routine diseases we used to treat because those patients also need attention. So hence I have chosen a topic which is very relevant and of commonplace. That seizures can be an early sign of an underlying brain tumor. This is just an awareness talk. This is nothing to scare or nothing to suggest that every seizure can be a sign of brain tumor. But I will broadly outline over the next few minutes that which seizure should be investigated and why. Basically, what is a seizure? सीजर होता क्या है? आमतौर पे आम भाषा में सीजर को मिर्गी कहा जाता है, दौरा कहा जाता है. Seizure basically is a short circuit of brain neurons. There are millions and millions of neurons which make the brain. Any dysfunction in the neuron function or connectivity can cause a seizure. So broadly speaking, majority of the seizures occur in the young, early age group. The causes could be many. They could be infections. What we find in this part of the world, the majority of the cause is something like cystic psychosis. माने जो आमतौर पे भाषा में कहा जाता है कि दिमाग में कीड़ा है, which usually occurs by intake of infected green vegetables. Again, not to suggest that nobody should take green vegetables or cucumber or things like that, but they should be properly washed and as hygienically consumed as possible. Coming back to the main thing, which seizures are suspicious of a brain tumor, which seizures should need attention of medical attention. Broadly speaking, I will say that a seizure which occurs in the adult age, say about 40 years, 50 years, seizure which has occurred for the first time, seizures which are without any cause of any fever, seizures which are associated with preceding few days of headache, or I would say that any normal adult who has seizures for the first time should be seeking medical attention. After saying medical attention, I'll say what medical attention. So basically, the first medical attention is history is important. That was it actually a seizure? Because too many abnormal activities of the body can be termed as seizures. Dora, mirgi is a very loosely used term, and sometimes people use this term very loosely, which does not convey any meaning to us as doctors. So we try to elicit as complete history as possible. It is not today my job to describe what is a seizure. It does not be possible. Seizure itself is a huge topic to be discussed. And if somebody comes with a suspicious seizure and we are trying to rule out an early sign of a tumor, first we do is a contrast MRI brain. That is some kind of a almost standard of care along with EEG, that is electroencephalogram. So what does the contrast MRI brain means? MRI means that the patient goes into an MR center. Our hospital has an MR center. So he goes through the MRI with a contrast injected into the vein. So this highlights any abnormal tissue. It may not be a tumor always. It may be, as I said, a cyst, neurocystic sarcosis. It may be some kind of an old infarct. Infarct means some kind of an old insult, some kind of an old undiagnosed asymptomatic sign of infection. Sometimes we found some dysplasias which were not picked up. But again, coming back to the tumor part, if the contrast MRI brain would show any small tumor with a reasonable, good, confident accuracy. So anybody with an adult onset of seizures must undergo a contrast MRI brain. Coming to the brain tumors, in addition to seizures, the first sign is, as I said earlier, a person who is not having chronic headaches, which are again very commonly labeled as migraines and other things. Somebody who is normally working, a normal adult, healthy person, suddenly starts having headache which is worse in the mornings, usually resides by the day, which subsides as the day passes on. By evening, it is good. Some patients give history they are awakened by headache. And another cardinal sign which we teach or were taught that headache usually is relieved by a vomiting, a spontaneous vomiting without any other illness. The moment the patient vomits, the headache disappears. That indicates the pressure inside the brain has gone. So, broadly speaking, which kind of tumors will cause seizures? Usually, the tumors which are irritating the cortical surface of the brain, meaning cortical surface means the surface which controls our limb movements. The surface of the brain or the area of the brain which is directly not containing the neurons which control the movements or which are basically tracks to convey the signal from the brain to the limbs or to other areas to they may not be presenting with seizures. But as a public awareness, I would, as a doctor, I would suggest that every seizure should be investigated thoroughly because early diagnosis of any kind of brain tumor is the success to the surgery. It has the best outcome. It has the best chance of patient receiving the optimal therapy for brain tumor. So what happens what kind of seizures we normally see? We see seizures which are there's a abnormal movement of the hand or legs. There may be sudden unconsciousness, or less dramatically, the patient momentarily just forgets. He's just absent from the surroundings. Sometimes he has a fall, but majority of the time it is just a brief seizure of the all four limbs or of the limbs which are on one side. It may be a simple deviation of mouth which may revert by its own. So grossly, सीजर इज कोई भी abnormal एक्टिविटी आपके या किसी भी मरीज के हाथ पैर में जो वो कॉन्शियसली नहीं कर रहा और कॉन्टिन्यूस है, इनवॉलंटरी इसको हम कहते हैं कि अपनी मर्जी के बिना हो रही है, दैट शुड बी टर्न्ड एज सीजर्स. It is important for members of the public. It may not happen in our home, God willing, but if you know about something about seizures, you should be able to help even a bystander on a public road, in a public place for that matter. So this patient should be taken to a doctor. He should be hospitalized. He should be investigated. And if at all there is a brain tumor, nowadays, again coming to brain tumors, there are two types of brain tumors. One is benign and another is malignant. The ratio of benign and malignant tumors is almost equal. And with advancing age, we more and more see tumors which are benign. Benign means they are not cancers. So cancerous tumors, of course, almost always are detected with headache and seizures. Non-cancerous tumors, sometimes due to their location, can achieve a large size without causing a seizure. After adults, I'll talk about briefly about children. Younger age group, meaning from birth till about 10 years, 12 years, 15 years, not 15 years, 10 to 12 years, they too can present with tumors. But seizures with the children is more often due to non-tumorous causes. They are usually in Indian environment, in Asian environment, they are caused by infections. But suspicion should always be there. If the facility is available, it should always be availed of and child should be investigated. Why do I emphasize again and again on seizures and brain tumors? It is not that uh, seizure is one of the most commonest feature, but certainly it is one of the most cardinal signs in almost 25% of the patients with brain tumors. And we see that they are being treated with drugs off and on. Once in a while, we see a patient who could have been treated earlier had the seizures been investigated by imaging modality like contrast MRI, as I said. And there are many other sophisticated modalities in MR as well. Once we find something in MR, then we can go in for MR spectroscopy to determine the nature of the lesion before the surgery, location of the tumor, the safety of resection of the tumor, and predict the kind of outcome we expect. So, to emphasize further, my purpose of my today talk is to awareness that seizures should not be ignored. God willing, no, then there should be benign seizures. There should be seizures without a brain tumor. As I said, there are a number of reasons of a seizure, ranging from brain hemorrhage to simple neurocystic psychosis, for which nothing needs to be done. But no brain tumor should be missed if he had a seizure. Having said that, mm, there are simple medicines available for treatment of seizures. Seizures should not be stigmatized. It is a disease. Epilepsy is a disease which is quite prevalent, and people are, if they are regular in taking their medications, they are often lead a normal life. There are few famous celebrities which I should not name who were on regular anti-epileptics, and they led a normal public life as well. This is an awareness session. You are welcome to share your concerns, queries, which I can address. We intend to make it a weekly feature only for the sake of awareness. And if you have any suggestions about which you want me to talk about next week, do let us know. We will come back to it, maybe same time next week. I think that should be all from my side. Stay safe, take precautions. Mr. Singh has a query. I'll take queries now. What kind of seizures do brain tumor cause? Brain tumors, brain is a very uh, complicated organ. So it depends where the tumor is. Say if the tumor is on the patient's left area which controls the left arm. So usually seizures will start on the left arm and go to the left leg. If the seizure is in the frontal lobe or the area which does not control directly motor movements, then the seizures will be may not be even there or maybe a generalized one. Intraventricular tumors may not cause seizures for a long time till the pressure really builds up. So to answer that question in a straight line is difficult, but I would certainly suggest that every seizure should be investigated. What type of tumor is a very subjective or rather highly technical talk. If you want, I can, but I don't think that will interest the public. What kind of tumor specifically will lead to should be suspicious of a brain tumor? I would generally say that every seizure should be investigated to rule out a brain tumor. Another question is, how long do seizures last after brain surgery? See, if you understand, once we take out a tumor or whatever lesion has caused for which the surgery has been done, head injury, anything, there is a scar inside. Any surgery is basically a controlled injury to the brain for the benefit of the patient. Right? The brain doesn't remain the same as the God created it. So there is a scar. Once there is a scar, it will continue to remain a focus of brain irritation, leading to short circuit, as I said. So it is generally not agreed that what is the optimal duration after brain surgery when the seizures will not occur. Normally, I would prefer, there are different school of thoughts. Some people say you should not even give anticonvulsant till the seizures occur. But in my practice, I would give anti-seizure medicines or what we call anticonvulsants for about a year. Then, depending on the disease, what kind of disease the patient has, we will try to taper them off. Taper them off means slowly reduce the dose over a period of 3 months with complete information to the patient that we are doing it in your interest and it may have a small chance of causing seizures. Sometimes it is possible, sometimes it is not possible. So again, there are no straight answers in medicine that for how long the anticonvulsants should be continued after a seizure. Another question is, how do you tell if you have a brain tumor or just paranoid? Very simple, get a contrast MRI brain, that is all. The contrast MRI brain is normal, then I would not say paranoid, I will say anxious. If somebody is anxious, yes. Investigation doesn't harm except the loss of money. If it can be cured by another question is that can brain tumor symptoms come on suddenly? Yes, yes. There are nobody knows the age of the tumor. What we know that the tumor is developing in the brain for quite some time. How long it takes for the brain tumor to cause seizures or any other symptom for that matter, even headache or weakness or unconsciousness, nobody knows. What we certainly know that after it achieves a certain size, the brain decompensates. Then the brain says, I cannot tolerate this much of extra volume in my head. Because head is, as in contrast to another organs, God has enclosed in a bony structure. So that bony structure will not be able to take more volume than it was designed for. So nobody knows for how long the brain tumor has been there and when it will become symptomatic, nobody knows. And of course, there's no case of mine to say that everybody should undergo screening or anybody who is anxious. If it is the anxiousness is bothering, they should get the investigation done. If there are any other queries, I'll be really very happy. Any other suggestions for any next session? I would be. Again, another question is, are seizures common after brain surgery? No. As I said, there are two schools of thought. Some people simply do not give anticonvulsants, even after brain surgery. But our thought is that anticonvulsants are really harmless. I would not say harmless, there are relatively very few side effects. If a patient throws a seizure, it's a really dramatic event for the family. It creates unnecessary panic. Simply giving anticonvulsants The patient takes it on time. He continues with his normal life as if nothing has happened. If it was a benign tumor. So it is always wise in my practice, at least I do give anticonvulsant for seizure. I anticipate seizures will occur. If they do not occur, some people stop medicines. We see in the practice, some people simply stop medicines. They say we will not take medicines, done with it. So they do not have seizures. But that is something, a difference of opinion. But in our environment, going to the hospital, calling an ambulance, taking care of a seizure patient is actually a problem. So looking at our local conditions is I would prefer to give at least anticonvulsant for 1 year. Then depending on every patient is different, depending on the condition, depending on the tumor, depending on the surgery, what kind of brain surgery patient underwent. So those kind of things determine the duration of possibility of seizures and continuation of anticonvulsants. Mr. Khan asks, what are the first signs of a brain tumor? Very difficult. Anyway, what we see in practice is first sign usually is a insidious or a slow onset of headache, which I previously described. Headache which comes in a person who is not a chronic headache sufferer, who is leading a normal life. So that headache which is worse in the morning, headache which is relieved by vomiting. Other signs, early signs could be seeing. The visual difficulty, I do not mean by the number of the spects, but by the, what do you say, the range of field you can see. The corners of your eyes stop. You do not realize that there's no vision in the corner of your eyes. The field of vision is restricted. So often these people can bang their shoulder into the door because they cannot make out where the door frame is. Unfortunately, we have seen people involved in road traffic accidents because they were not aware that they are having a brain tumor. There's a loss of smell is something very subtle sign, but very early sign. A certain location in the brain that is all called olfactory groove, meningiomas. The loss of smell, if you ask the history when the patient comes, he says, I do not smell of flavor of a food or smell of waste since long time. I accepted it. Next early sign is people come with hearing loss. They cannot hear from 1 year, and it is taken as senile loss of hearing. That elderly man simply lost his hearing in 1 year. But these are few very basic without causing any, which we should be looking out for. That these are the early signs of a brain tumor. How does a patient feel when he or she has a brain tumor? See, it affects the human. The brain is what I am. Brain is what gives me my knowledge, my sense of being human. But majority of the patients, I cannot actually comment on the feelings, but if detected early, the majority of them are able to resume the quality of life. So the aim of brain tumor surgery in this context is to maintain the quality of life, including the feelings and the work which they were doing before. Not only physical work, but also the intellectual work. No surgery, no tumor should cause deterioration of quality of life with which he came to us. He has sophisticated equipment. Technology has advanced in last 20 years or so. We can pinpoint a tumor. We can only touch that tumor. Unfortunately, today I don't have that few good demonstrative videos that we can just take out a brain tumor through a 4 millimeter hole in the brain cortical surface. and the patient is walking. The rest, the fate will depend upon the whether it is a cancerous or non-cancerous. That the disease will take care of its own. Again, in the context of brain tumors, surgery is the only thing which is considered the first line of treatment. Every other procedure is adjuvant. So surgery has to be done. The good surgery is only possible if it is detected in time. So my emphasis is that patient should be detected in time and offered surgery. The question is, what are the side effects of removing a brain tumor? This is a touchy subject anyway. I will flip the question. Nobody does a brain surgery for side effects. Side effects are of the tumor. So surgery per se, as a neurosurgeon, I sincerely do not believe has side effects. Of course, tumor has caused something. That is why people or the victim has come to the doctor, and doctor will try to do whatever best as possible. Even if we do not do surgery, let me answer it that way. The tumor will continue to cause side effects for whatever he is having. The aim of modern neurosurgery is that no new deficit should be caused by microneurosurgery of the brain tumor. If you remove a tumor and patient is worse than before, that will be called an accident. That will not be called as a side effect. Sometimes we do not find a safe corridor. It may be possible. Then that thing is discussed with the patient at length and breadth that this is a possibility. Whether you accept this or not, whether this is caused by the fate or by my hand, that is something which is, yes, we can predict there will be deficits, and then we can take accordingly. But side effects in brain tumor surgeries, I do not accept. I find it rather funny that surgery does not cause side effects. Surgery can have risks. I understand. Those risks have reduced in the last 50 years from 40% to 1%. But surgery doesn't cause side effects. Side effects are of the disease, not of the surgery. Please, if any other questions. Um, does patient experience seizures after meningioma removal? Yes. After any kind of brain tumor surgery or any kind of surgery, even for head injury or any other procedure, can have seizures. As I said, any manipulation with the brain will leave a scar there. Once there is a scar, there will be some possibility of seizures. The percentage varies from patient to patient and the nature of surgery, location of the tumor. If it is in the cortical region, it is very high. If it is in the deep in the brainstem and other places, then the possibility is very low. But theoretically answering, yes, it is possible. Please tell me about the recovery of brain stroke patients. How long it will take to be normal? If you agree, let us take this brain stroke next week. Normally, a brain stroke should not happen in modern times. We should be able to treat a brain stroke as a heart attack is treated. And I'm not saying that heart attack, no patient of heart attack dies or become disabled. With the modern technology, the brain stroke is treatable if patient reaches hospital in time. So recovery again will depend upon specific territory which is affected, age of the patient, the damage the stroke has caused to the patient, and of course the rehabilitation part of it, the commitment of the family, the rehabilitation efforts which are put in. Majority of the people usually are able to be independent for activities of daily living. But abstractly talking here in percentage is not a wise thing to do. I take it as a good suggestion. Maybe we can talk about brain stroke next week. If there are no more queries, give me other suggestions. One suggestion is brain stroke. Ms. Pressure, I'll request you to join in next week. We'll talk in detail about the brain stroke and its rehabilitation.